This is a phone call with a trauma specialist in Australia. I need all the MPs, GPs, therapists, psychiatrists, everyone to actually watch this, because partway through this phone call, he starts talking about so many things that I have mentioned in this channel. And it's very important that you watch the whole phone call, please. You're already taking the time to click on it. Just get through the whole thing, yeah?
Yeah, pretty good. How are you doing? Good, thank you. I'm trying to get some information. Your place looks amazing. It's the only thing I've found in all of Australia that actually seems to have everything that someone with trauma really needs to recover. Yeah, that's we designed it that way. We've been doing this work for 10 years. We actually get people from overseas and interstate, and we specialise in trauma resolution. So we do a lot of therapy that other programs don't do. Do you know how people who are maybe like on a lower income would access similar services, or is it just like if it's private only, like? So yeah, Medicare doesn't pay for it. Private health insurance pays for incredibly for very little. Usually, so what we do as a program is we don't roll the same program out over and over. What we do is we do an assessment, which includes a questionnaire and just gather a bit of information about you or the person that's applying, so that we can actually build a program that we think's got enough therapy in it. So yeah, again, costs do vary. It depends on whether we do inpatient or outpatient, because there's pros and cons for both. The short answer is people on a lower income usually either apply for finance. There's companies like what are they called, TLC, that actually does finance for these kind of things. Otherwise, the alternative is the compassionate release of superannuation scheme, if you've got enough superannuation that you want to dig into. So they would actually let you access that to do this type of thing? Yeah, 100%. Oh, okay. So there's a company called Release My Super in Victoria.
So, wait till you hear the costs. But he's saying that in order for someone who basically isn't wealthy, in a high-paying job, or, got a lot of money, they would have to access their super or access finance. But wait till you hear what happens when he starts talking about the super and the costs and just all of it.
Run by a lady by the name of Kathy Baker and her team. She's quite lovely. They assist people with the application. So basically, the ATO needs to be applied to. So you need a quote, and then you need a supporting letter from a GP and a psychiatrist. That's something that Kathy can organise, because she's got psychiatrists and GPs on staff. Okay. I think their fee is about $1,800 to do all of that. Half of that actually goes to the GP and the psychiatrist. Okay. But you need a quote that covers everything, including GST, as part of that application. That goes to the ATO, and then the ATO signs off on it, and then that goes to your superannuation scheme, and then that amount of money gets unlocked and sent to you, which then they use to pay for treatment. The only downside to that is you need a certain amount of money left in your superannuation to cover basic insurances, and also you will pay 22% tax because you're withdrawing that money early. Yeah. Is there a sort of window or a starting sort of price that people would be looking at, like the minimum that they would ever pay to do one of your packages or therapy? Well, so I can give you ballparks, but it really does. It just depends on how much we do. Yeah, like for example, just sort of like a ballpark on an example for someone who, say, has had complex trauma their whole life, gone untreated, and like their nervous system's fried and they just really want to reset, Okay, so if we did everything that we so if we did, so one of our bigger programs, so the last 3 or 4 large programs that we've done, where we've worked for people for months, so we basically done, because we like to do a prep phase, which is where we work with you where you are, so we can do a whole bunch of pathology and dietary change and supplementation and plug you into the psych team to develop rapport and maybe do a psychiatric review, all of that stuff. We do that for about a month before you come, but it's about stabilising, improving your situation. About 20 to 25%.
So that's a cheaper option because you don't have to. You take care of your own accommodation, but you're still going to have to pay for accommodation somewhere and like transport.
As a way to resolve trauma and PTSD. So the end result is always the end goal is always the same. It's about putting depression, anxiety, stress, and PTSD numbers into a remission range, but also improving sleep, improving gut health, improving genetic health, because they're all intertwined. You can't just treat the mood. You also have to treat the body as well.
It's all connected, isn't it?
The outpatient programs are usually anywhere from 30 to 40,000. It just depends on how much we do.
Okay, Saddle.
So what we like to do is do an assessment, which doesn't cost you anything. We like to know what we're dealing with, and then we have a chat to you and point out what we see in that assessment regarding the types of therapy that we think are worth funding. And then if you want to hire us to put together a program where we provide that therapy, then we talk to you about what's achievable financially, and then we try and build you the best program we can within that budget.
Wow. Do you find that you're getting a lot of people coming to you like just filled with pills from doctors that they have to get out of their system as well?
Yeah, so we call that polypharmacy.
Yeah.
Polypharma, which just basically means many medications. Yeah. Over the last 5 or 6 years, the amount of medication that we've seen has been rising. We only used to see people on 1 or 2 meds. Now I'm seeing people on 6 to 8.
Wow.
And that's the thing in Australia, is unlike America or Europe, where if the medication's not working, they discontinue it. In Australia, they up it and just add more.
Yeah, it exacerbates a lot of our issues, doesn't it, with our nervous system and our guts and everything.
Yeah, so what we find is that PTSD is an injury of the central nervous system, and so putting a person on benzodiazepines or antidepressants or antipsychotics doesn't actually treat that. It just basically makes them emotionally numb, and then we see a lot of side effects because of the medication. And also we get people that are taken off the medication far too quickly, which then causes more side effects. There is a lovely company called Papermate. It was designed.
Take note.
Does these really nice parabolic tapering programs, so it helps people to come off medication safely without doing it too quickly. So if you look at papermate.com.au, it's an app, and there's also a service to actually help people to come off medication safely.
Amazing.
And there's also a test called a PGX panel, which is a cheek swab genetics test, which is under $200 to actually show how your body metabolizes all meds. We do those tests with everybody because it helps us to understand whether a person's metabolizing a medication safely or properly. Great little test to do. I think everyone should do it. So PGX panel.
PGX panel, that's amazing. Thank you. I found out more just from this phone call than I have ever from any Australian GP.
Well, this is our wheel. We like this. Getting depression, anxiety, and PTSD into a remission range is what we do. We do it every day. So our job is to find what works and then just do more of that.
Yeah. Do you think Australian government's ever going to catch up, or do you think it'll always be a private thing? Because you're in Queensland. I've been trying to search all over the whole country to find someone like you.
So, unfortunately, trauma therapy is about 30 years behind the rest of the world.
Yeah.
The only things that the federal government will recognise are exposure therapy and EMDR.
Yeah.
And both are just really old. We do what's called bottom-up or somatic therapy, which is basically about helping the central nervous system to regulate and heal. And all of that stuff feels really good. And once that work's done, it's done. So we do things like playfield therapy, brain spotting therapy, equine or horse therapy. We also do neuroacoustic sound therapy, frequency-specific microcurrent. We do a whole bunch of stuff, and we do it because it works. Whenever we find a new therapy, we trial it, and if it works, we keep it. If it doesn't, we don't. So the program now, 10 years in, is just full of stuff that works.
Because it's all backed by neuroscience, whereas the Australian doctors are still just in that mental health mindset.
Well, if they're not trauma-informed and trained, they'll miss it.
Yeah.
So we see a lot of people that they'll have PTSD or adverse childhood events, and if they're not screened properly, they end up with a whole bunch of other diagnoses like depression, anxiety, borderline personality, ADHD, OCD, and
You end up like
with
me.
more problems than you started with. Yeah. So some people kind of get unstuck, and then they hit despair, and when they're not offered effective therapy. Do you know, like as an example, there's actually a medical procedure to improve PTSD called an SGB.
What's that?
So it's called a stellate ganglion block.
Oh, yes. I've seen the ganglion block thing online, yeah.
Yeah, so the Stellar Clinic does it in Melbourne and Sydney. It's basically just, it takes 30 minutes and it's an injection into a nerve bundle in the right side and the left side of the neck. If you want to, or you can just do the right side, and it can improve PTSD, it can reduce PTSD symptoms by up a third to a half, improve sleep, reduces triggering. Doesn't last forever, usually lasts for 2 or 3 months. But if you follow it up with really good trauma resolution therapy, then you can stay in remission for years.
But the thing is, there's no GPs out there, not enough GPs who recognise the trauma to get you those sort of referrals. They're throwing pills at us instead.
Yeah. So that's one of the reasons why we love to do an assessment, because we use assessment tools. Like there's a questionnaire called a PCL5 that gives you a score out of 80. That is recognised around the world. It's a score out of 80. Anything above a score of 31 is deemed to be PTSD likely. And the higher the score, the more likely it is. So
I'm going to do it.
The thing about PCL5 as a metric is that if you apply really good therapy, that score comes down to a remission range. So I've seen people, that are 70 out of 80 that come down to, after really good treatment, they come down to a 10, which just means that the trauma is resolved, the central nervous system's working properly.
Wow, I wouldn't even know what that feels like. I'm going to look into that stuff that you said, because up until 2 years ago, I was working. Trusted So, as we can hear here, it's an injury in the central nervous system. It requires a tailored, personalized treatment plan that is done after a thorough assessment. And it's fucking expensive, because you can only access it through private. When you go to someone who is a trauma specialist in Australia, who just is a therapist, they won't know about any of this. None of this is understood by GPs, psychiatrists, psychologists, because that mental health box is all they live in, and trauma is outside of that. And as you heard him say, we're getting other diagnoses as a result. So I ask you all this: why are GPs our front line for mental health? Why aren't we having specifically like trauma-informed GPs? Or why aren't GPs having some kind of guidelines specifically for trauma outside of the DSM-5, so that they can do referrals to the right kind of specialists? It is a central nervous system injury that requires so much work. And as he said, Australia's 30 years behind the rest of the world. I'm not going to wait 30 years. I'm not going to sell everything I own. My super's not enough. I can't get a loan. So I have no chance in this country. Many people have no chance. Only the rich can afford to heal trauma. But they don't really experience it, because they're the ones causing it. So it's never going to be understood how badly this is needed down here.